Hey everyone, welcome to another question and answer session for MRCS exam. Here the question: a 23 years old climber falls and fractures his humerus. The surgeon decides upon a posterior approach to the middle third of the bone. Which of the following nerve is at greatest risk in this approach? Here the nerve are ulnar nerve, antebrachial nerve, musculocutaneous nerve, radial nerve, and intercostobrachial nerve. So in this question, the key point here is the posterior approach the middle third of the bone. That means the middle third of the humerus. So we have to find out the nerve which is located at the middle third of the humerus, and it may be damaged during the posterior approach. So here we can see the different nerve in relation to the humerus. First of all, in this area, now this is the surgical neck area of the humerus, and when this area fracture or any surgical approach to the surgical neck of the humerus, there may be chance of damage of the axillary nerve. And here this is the medial epicondyle, and here it is the lateral epicondyle. So when in a fracture to the medial epicondyle or surgical procedure in the medial epicondyle, there is a chance of injury to the ulnar nerve. And here it is the, we can say this is the middle part of the shaft of the humerus. So the posterior approach to surgery to the humerus in this area, it may cause damage or injury to the radial nerve. So the middle third of the clavicle, middle third of the humerus, there is a chance of injury to the radial nerve. And in surgical leg, axillary nerve may be damaged, and in the medial epicondyle, there is ulnar nerve. So ulnar nerve may be injured. In this picture here, we can see this is the surgical neck of the humerus, and here is the axillary nerve. So surgical neck of the humerus fracture may injure the axillary nerve, and there we can see the shaft, middle shaft, and here the radial nerve. And the supracondylar area, in case of supracondylar area, we can see this is the median nerve. So median nerve may be injured during the supracondylar fracture, and here this is the medial epicondyle, and there is ulnar nerve. So in relation to the humerus, there are four important nerve and may be damaged or injured of this nerve in different anatomical location, such as the surgical neck, axillary nerve, mid shaft of the humerus by radial nerve, supracondylar area, median nerve, and the medial epicondyle area, it is ulnar nerve. So here the answer is ready now. In case of middle third of the humerus, there is chance of injury of the radial nerve, and you can see the ulnar nerve injury occurs during the medial epicondyle fracture. Antebrachial, it is not related to the humerus or close to the bone. Musculocutaneous, it is so not closely, because the musculocutaneous, it lies between the biceps brachia and brachialis. So there is no chance of the injury of this nerve because it has no direct bony contact. The intercostobrachialis nerve, it also a nerve which is not close to the humerus because it supplies the intercostal space and the arm, but it is not closely contact to the bones. So the final answer is the radial nerve, because the radial nerve, it is located at the shaft of the humerus. Thank you all.